Hello, everybody. Welcome to our webinar, Perinatal Education Initiatives on Radon. And we are delighted to present our radon screening tool to you that has been developed with the Canadian Association of Nurses for the Environment and Health Canada. My name is Fiona Hanley, and I am a member of CANE, and very delighted to be able to present this screening tool with you today. Next slide, please. At CANE-ACIIE, we commit to righting the wrongs of colonialism by strengthening our knowledge of and relationships with Indigenous peoples where we live and work, and by adopting decolonial and anti-racist practice and discourse. And for those who are not familiar with CANE, the Canadian Association of Nurses for the Environment, we are part of the CNA, the Canadian Nursing Association's network of nursing specialties, and we represent nurses who are dedicated to the improvement and promotion of planetary health. Now I'd like to introduce our speakers that we have today. So we are delighted to have Casey Knowles. Casey Knowles has a bachelor's degree in political science and ecology and is entering her final year of nursing at the University of British Columbia. And Casey's research focus is on climate-related illness and environmental threats to health security, and she has a background in Arctic and restoration ecology through an international lens. We also have Madison Pekoski, who joined Health Canada's Environmental Health Program in June 2019, and since then she has done a couple of different roles within the program. She started on risk communication and public involvement as risk communication and public involvement officer for Alberta and the North, and in this role she helped educate people about the risk of chemicals and how to mitigate the risks from them. She then transitioned into the regional radiation specialist role in December 2020, where she focused on spreading awareness of radon gas.
All right, I'm going to share my screen now. I'll just pop up my presentation. All right, and can I just get a thumbs up that we can see my screen properly? Awesome. Okay, so I'll be presenting on what radon is and what you need to know. So we'll start by saying that I'm presenting to you today from Edmonton, Alberta, which is in Treaty 6 territory, home to many diverse Indigenous peoples whose ancestors' footsteps have marked this territory for centuries, such as the Nehiyaw, Dene, Anishinaabe, Nakota, Iska, Niitsitapi peoples, and we also acknowledge this as the Métis homeland. So we'll start off by what is radon. So radon is a radioactive gas that is produced naturally by the breakdown of uranium in the ground. Radon is colorless, odorless, and tasteless. So it's released from the ground, and when it is released into the outdoor air, it is diluted and is not of concern. However, in enclosed spaces like a home, it can accumulate to high levels and it can become a risk to you and your family. So natural radiation is everywhere. There's four major sources of public exposure to natural radiation. So cosmic radiation, terrestrial radiation, inhalation, and ingestion. And then there's 4 categories of artificial sources of radiation. And with that, it is estimated that radon represents almost 50% of a person's lifetime radiation exposure. So we'll talk about the health effects of radon next. So the route of exposure for radon is through inhalation, and radon's radioactive properties mean that it spontaneously changes and releases energy. And the energy release causes damage to the lung cell tissue, which results in an increased risk of lung cancer. So what are the health risks? So radon is the #1 cause of lung cancer in non-smokers. It is a known carcinogen, and it kills more than 3,000 Canadians each year. So the health risk from radon is long-term, and it depends on 3 different things. So how high the radon level is, how long you're exposed, and whether or not you're a smoker. So this is a chart that compares different causes of death with radon. So as you can see, the annual deaths in Canada from car accidents, carbon monoxide, and house fires combined is less than the amount of annual deaths from radon each year. So the only way to know if you have radon is to test. And despite the significant risk radon poses, it is preventable. And again, the only way to know is to test. So where can radon be found? It can be found in all buildings. So it can be found in homes, workplaces and offices, schools and daycares, and other buildings. But the biggest risk for radon exposure is at home because this is where we spend most of our time. This map shows the radon concentrations in Canada. So as you can see, it varies quite a bit across the country. So this map was developed using data from the Health Canada Cross Canada residential surveys that have been completed over the last 10 years. And it's estimated that approximately 7% of homes in Canada have high radon. So it does vary quite a bit, but something that's important to know is that there's no areas of the country that are radon free. Radon is found in every building, but the level varies. Even two houses that are built side by side can have a different level of indoor radon. So how can radon enter a home? So it can enter through any cracks, openings, gaps in the foundation, walls, or floors. And then also the air pressure inside of a house is normally lower than the pressure underneath or around the foundation. And this difference in pressure can act like a vacuum and draw radon in through foundation cracks or other openings. So once radon gets inside of your house, it can build up to dangerous levels. And it's important to test so that you know what your level is. So with radon testing, we do long-term testing. And why do we do long-term testing? It's because levels can vary quite a bit, even over a 24-hour period. It's ideal to test during the fall and the winter months, and Health Canada recommends at least 3 months. And then just measurements that are gathered over this longer period of 3 months do provide a better estimate of what your annual average exposure is. So there's several different factors that can influence your radon level, which includes building design, building conditions, and occupancy patterns. So for example, opening your windows can reduce the level a little bit, but so that's why we recommend to test during the fall and the winter months. So how can you test for it? It's really easy. You can either purchase a do-it-yourself test kit from takeactiononradon.ca/test, or you can hire a certified radon measurement professional. Again, the most important thing to know is to test for at least 3 months during the fall or the winter. So this is just an infographic that we have of where you can place your long-term radon test kit. So go over it in a little bit more detail. So where you want to place your test kit is in a typical breathing zone, away from ventilation or fans, away from electrically powered appliances, away from heat sources, and away from other objects to allow for normal airflow. So you also want to make sure that you're placing it somewhere that you're spending at least 4 hours a day. So Health Canada's radon guideline is 200 becquerels per cubic meter in places that we do spend more than 4 hours per day. So Health Canada recommends to take remedial measures if a dwelling is over 200 becquerels per cubic meter, and the higher the radon concentration, the sooner the remedial measures should be undertaken. And while the health risk from radon exposure below the Canadian guideline is considered reasonable, there is still an associated potential health risk, which is proportional to the exposure. So as we can see here, when should you reduce your radon levels? So if you've tested your home and it's above the Canadian guideline of 200 becquerels per cubic meter, we recommend to fix your home within 2 years if it's 200 to 600, and if it's above 600, we recommend to fix your home within a year. So how do we reduce the radon level? It's very easy. There's a few different things that that someone can do to reduce the radon level in their home. So the best way to reduce the level is through active soil depressurization. And these systems can reduce the radon level by up to 90%. And increasing ventilation can also lower the radon level by 25 to 50%. So these techniques to lower the radon level are very effective and they can save lives. And the radon mitigation systems can be installed in less than a day. So another important thing to note is Health Canada recommends that a professional that has been certified under the Canadian National Radon Proficiency Program, or CNRPP, is the person that does it because they have been certified. So we'll go over a little bit about what active soil depressurization is. So basically, it can also be called active subslab depressurization. It's the most effective, reliable, and common technique. For it, a pipe is installed through the foundation floor slab in the basement, and the pipe is attached to a fan that is continuously running that draws the radon from beneath the floor slab and it vents it outside. So as you can see on this side, there's a fan and then it vents out the side of the home. The system can also reverse the air pressure difference between the house and the soil, which reduces the amount of radon that is drawn into the home through the foundation. So the typical cost is usually $2,000 to $4,000. And as I said, it is recommended that a professional from the CNRPP, Canadian National Radon Proficiency Program, is hired to do the mitigation. So here is a list of resources. If you want more information, you can visit canada.ca/radon, take action on radon.ca if you want to buy a test kit. And then you can also visit cnrpp.ca if you're interested in learning more about mitigation. And I'll stop sharing my screen and I'll pass it over to Casey.
Okay, thank you very much, Madison. I'm just going to bring up my screen here. Okay, can you see the presentation?
Yes, I can. Thank you. So my name is Casey. I am coming from the city of Vancouver, so that is situated on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations, where I live, I work, and I also get to enjoy the lovely city and nature. So just to start, I want to talk a little bit about our literature review. And through this, we realized that in order to reach the perinatal demographic, early intervention is essential. Introducing education during pregnancy, planning, preconception, all the way through to discharge teaching after birth. Since radon testing takes time, it's best to provide education while parents make other important health decisions regarding their pregnancy, adoption, or other methods families take to having children in a way that allows for follow-up care. Providing education to the perinatal demographic allows for ongoing teaching throughout pregnancy and action to be taken, such as home testing, reviewing results, and accessing resources needed before the child arrives. It is noted that this method is idealistic and in many cases will not be possible to target families early in pregnancy and have follow-up care. This is why we have provided resources adaptable to various scenarios our families will encounter and resources specific to individual completing the screening. Also, what we discovered in the literature review is that educational initiatives that are the most beneficial for the perinatal demographic are grounded in interprofessional collaboration, can adapt to different levels of education, language abilities, and social determinants of health. They use inclusive language and highlight the importance of family-centered care, and they can integrate the use of technology, again, with that emphasis on continued education and followed-up care. So objectives for our project was to create an educational tool that can be used in person or at a distance and can be adaptable for equal access across all social determinants of health, and to have an educational tool that encompasses screening, brief intervention, and provides solutions and recommendations at the same time to reduce health-related anxiety regarding exposure risk to radon. So to tell you a little bit more about it, brief intervention is a technique that is used to initiate change and is most commonly associated with unhealthy or risky behavior as an intervention technique to create change. It utilizes screening or identification where an individual's risk can be assessed by the use of a validated tool. And then once that is complete, feedback is followed up based upon the assessment responses. And this technique relies upon personalized feedback related to an individual's specific risk. And next, we're going to talk a little bit about motivational interviewing. Motivational interviewing is what brief intervention is based upon. The purpose of this strategy is to be non-judgmental and non-confrontational. And in order to be successful, there must be feedback provided in a non-judgmental and objective fashion based on the information an individual provided during the conversation. Motivational interviewing aims to provide both an assessment and prevention program that is adaptable to individuals with varying levels of readiness to change. It is possible some individuals have never thought about their risks at hand or making changes to their life, while others may have thought about it, but have not made any steps towards making change. And others may have already begun to make changes, but are unsure of their next steps. So ultimately, the goal of motivational interviewing is to get individuals to think differently and consider their options for change. In the creation of our Radon screening tool, it is accessible online and it is mobile friendly. It can be accessed through a QR code or through the CANE website. It can be completed independently or with a healthcare practitioner, and the 5-question assessment can be completed. When answers are submitted, a document with a specified brief intervention will be provided, and then you can download as a PDF or even print it for future reference. For those not savvy with technology or who do not own a device, because we are focusing here on equal access, paper copies will be available at healthcare practitioner clinics. So why nurses? Nurses heavily influence the way in which patients understand and prevent known illnesses and adverse effects. They are responsible for translating scientific knowledge into understandable concepts with achievable patient management and care plans. It is our goal to have a tool designed for nurses by nurses and facilitate conversations about health and minimize health anxiety and really help to translate that scientific knowledge to everyday knowledge. And while it's not just for nurses, any healthcare practitioner can use it and any individual can utilize this tool as well. We really wanted to place focus on nurses. So understanding that many healthcare practitioners and individuals in the perinatal demographic may have very limited knowledge of radon, to help with that, we created supplemental documents to support the success of our assessment tool. A nursing toolkit was designed with information specific to radon, motivational interviewing, brief intervention, providing education resources to further their knowledge, and therefore increasing their confidence as providers to teach and complete radon assessments with their patients. So the supplemental documents were created to explain what radon is and the health consequences it leads to. On this document are examples of questions that can be utilized on posters distributed in healthcare practitioners' waiting rooms with QR codes to the assessment tool on the CANE website. And we do have posters available with the QR code to our screening tool, available in limited quantities by request, but I'll tell you a little bit more about that later. So research shows that a nurse or a healthcare practitioner is less likely to conduct an assessment if they are not confident in the material that they are educating on and their confidence in their educational skills themselves. Using the following categories, the nursing toolkit provides basic education to address this. And also in the next stages of our project, we're hoping to design training material for healthcare practitioners specific to radon and the perinatal demographic. So as you can see, categories are what is radon gas, what does this tool assess, goals and objectives, brief intervention and motivational interviewing, and where they can access more information. Validation. The provider assessment tool, our introduction document and assessment tool were sent for validation to healthcare practitioners who work in the perinatal demographic. The educational tool, assessment tool, and feedback form were sent to parents and actual individuals within the perinatal demographic. We had feedback forms that were returned and reviewed, and we made changes based on recommendations that have been made before launching the tool and talking to you all today. So what's next? This is really exciting. We are proposing using an intersectional lens to continue with the project, increasing awareness of radon gas, meeting the needs of new parents through a nursing knowledge translation project, specifically with an equity focus. During the first stage of our first phase of our project, those who are least likely to access radon resources are those from equity-seeking populations. And we propose validating and adjusting the tool created in part 1 that we're presenting to you today to better meet the needs of equity-seeking populations through presentation of the tool and examples of how to use the tool with different populations, and pilot the project in equity-seeking communities with preference to Indigenous communities. So the posters I told you about, so here are 2 examples. We have designed 6 QR code posters that can be displayed in healthcare facilities to promote the educational assessment tool we have designed. We can print and send a limited number upon request. So either please contact myself, contact Jack or Fiona, or even use our the CANE website, and we can give you more information about how to do that. All right, so now I'm going to take you through our Radon tool and show you about what it does. I'm going to share my screen now. All right, Fiona, can you see that?
Yeah, that looks great. Thanks, Casey.
Perfect. So what you'll notice here right away is we have highlighted terms. So with our equity focus, we are understanding that people may be coming from various backgrounds, language abilities, education. And so any words that may need further definition, we have highlighted. And if you hover over it, it will give you a little pop-up box with another explanation or another way of using that term. So for purpose of this assessment, we're going to say yes to most of the questions, so we can have a good look at how many resources are available to us. So first question, in your home, do you have a basement or live on the main floor? As we learned from Madison earlier, these are increased areas for radon exposure. So we're going to select yes. Do you have sources of ventilation? Pop up here, such as ceiling fans, portal fans, opening windows and circulating air, more than one door to the outside that opens and closes, an air exchanger or heat recovery ventilator. So as Madison said, this can have a heavy impact on radon gas exposure. So I'm going to say yes, more than one of the above. In your home, do you have children under the age of 12? So if yes, no, but we also understand that families may look different. Your children may not be in the house at all times. Maybe you are a caretaker. So we do have options that will also limit the level of exposure. So we're going to say yes, we have children. Do you or members in your home have a history of smoking or currently smoke cigarettes or tobacco? We'll say yes. And do you or anyone else smoke cigarettes or tobacco inside the home? We'll say, I don't know. Are you renting your home? Again, equal access. We want to be able to give information to everyone who needs it. And we understand that not everyone is in a situation where they own their home. And we want to be able to tell you what you can do about that. So we'll say yes. How do financial circumstances contribute to the likelihood you will test your home for radon? Now, this is a really important question because we do want to offer as many financial aid information or resources as we can, because we know it's expensive, and especially with inflation, knowing what to do with your money can be really difficult. So we'll say they somewhat affect testing my home. Next. And then I'm going to purchase a test kit after completing the screening. You can be absolutely honest. We do want your honest answers. You don't have to say yes if you aren't sure. So here we'll say, I don't know. I need more information. And you just submit. And now here you have categories designed specific for you. So this is a brief intervention that we were discussing. So where can I purchase a radon gas kit? There's a little blurb with direct link to where you can find one. I'm concerned about my radon gas exposure and its effect on my health. We have resources to find a healthcare facility near you. To speak with a nurse about non-urgent health issues across Canada, dial 811. And I do want to mention on this part here, if you dial 811 or you talk to your healthcare practitioner, they may not be educated on radon. So if you are going to talk to your healthcare practitioners, tell them about your concerns for lung cancer and why you have those concerns. Because while they may not be able to address radon, they will be able to address your concerns about lung cancer. And you can also contact your local Health Canada radon specialist, and it gives you the contact here. I live in a basement or main floor. How does this increase my exposure risk? So all homes in Canada have radon gas in them, and concentrations differ greatly across the country, but are usually in higher areas where there's a higher amount of uranium and underlying rock and soil. It's confined or enclosed in poorly ventilated spaces, as we know. And I do want to mention, if your neighbor does it, or maybe the person down the street does it, and their levels are within acceptable range, that doesn't mean that your house is going to have the same result. Every house is different because every house is built differently. And it's important, no matter what, for you to test your own home in the areas that you reside most often. So because this is a perinatal design tool, we are wanting to reach those new parents, but this tool can be used by anyone. So if you don't have children, you can still absolutely use this, recommend it to your friends, and they can just select no. But if you do have children, there is information we have specifically for you. Since children still have developing organs, rapidly growing tissue and cells are very vulnerable to DNA damage from radon exposure, as their DNA is being replicated. So any resulting genetic mutations can be propagated to all cells arising from the damaged cells. So that sounds very confusing. But what it means is that children are just at an increased risk. They weigh less, so their overall exposure, the amount that they absorb per kilogram of their body mass, is much greater compared to an adult. Children also breathe faster, and an infant or small child will take breaths 2 to 3 times faster than adults. And since they have such little lungs and are often more active, faster breathing means more radon exposure. Children also have more life left. So radon exposure causes DNA damage and genetic mutations that may take 10 to 30 years before lung cancer is diagnosed. So early life exposure means a person is more likely to live long enough to eventually get cancer for it. So again, this is a long-term risk. You don't have to worry about immediate risk, but it is good to get your house tested and just know what you're dealing with, and reach out to those healthcare practitioners that you trust for more information. Here we also have a blurb about smoking inside and increasing the risk to radon gas, as was covered by Madison in the earlier presentation. And now what we're really wanting to focus here is, what can you do if you can't afford to have your home tested, and what are some mitigated resources? So here I found as many financial assistance programs as possible that are listed here based on the province you live. But we also want to highlight that there are short-term radon monitors from in many local libraries. And what we do, Health Canada recommends a long-term test. If you're concerned, you can start with a short-term test and then follow up with a long-term test afterwards. Here, what if you're renting? It is the obligation of the landlord to provide a healthy living environment, but there's currently no existing policy that states a landlord must test your home. So Health Canada recommends having a conversation with your landlord about radon kit purchasing and possible radon removal. And if you need to access more information about this, we have listed 6 sources here where you can follow up. And then lastly, we just have another section where you can follow up with any concerns or questions that you might have. And that section is provided to everyone who takes the assessment, so you don't have to worry about which box you have to check to get that. So here you can reset the tool and do it again, or print this page, and we are also coming up with a way where you can download it as well. So that is all from me. I will pass it back to Fiona just to give a nice little closing, and thank you all for coming.
Thank you so much, Casey, for that really excellent presentation. And thank you so much to Madison as well, too, for the really important information about the radon, the importance of testing for radon. And thank you especially to Casey for all of your hard work on developing this screening tool. And for everybody who's interested, yes, please do check our website, CANE-ACIIE.ca, and you'll find the Radon screening tool there, as well as other information about the Canadian Association of Nurses for the Environment. Thank you so much.